Hi, I'm Susanna, and our presentation today is on kidney stones. I'll be talking about the demographics of our patient, Peter Parker, and the pathophysiology.
Hi, I'm Jenny, and I'll be talking about the pharmacological interventions.
Hi, my name's Alicia.
And I'm Shannon.
And we will be discussing nursing interventions
and the healthcare standards in relation to Peter Parker.
Peter Parker, a 52-year-old male, was just admitted to hospital. He is single and works full-time as a stockbroker. He is obese and suffers from type 2 diabetes. His lifestyle results in a high-stress work environment and works long hours, eats takeout 6 times a week, and only consumes soft drinks. His family history suggests his father had kidney stones. Clinical manifestations. When admitted, Peter complained of pain when urinating and reduced volume of urine. The urine was cloudy and foul-smelling with blood in it. He found it difficult to sit or find comfortable positions. His temp is 37 degrees, and he is feeling nauseous and has been vomiting. His heart rate is 110, and his BP is 158/80, and his resp rate is 24. He rated his pain on his side and back, which radiated to his abdomen 9 out of 10. Peter Parker is suspected of suffering from calcium kidney stones. Pathophysiology. There are multiple types of kidney stones, and they are classified by the minerals or ions that make up the stone. The most common types are calcium oxalate and calcium phosphate stones, and they are explored in our presentation. Kidney stones are also known as calculi or urinary stones, and result from salts in the urine aggregating together when urine becomes highly concentrated. Crystallization occurs when the concentration of solutes in the urine exceeds the saturation point in the solution. This supersaturation of urine causes precipitated salts to form insoluble crystals and fixate on the nephron and grow into larger stones. The surface of the renal tubules and papillae drag small crystals to adhere and aggregate into an organized mass. This process occurs more rapidly when the urine pH is unusually high or low. An alkaline urine pH greater than 7 increases the risk of calcium phosphate crystals forming. Kidneys have innate mechanisms to prevent supersaturation, crystallization, and the growth of stones. However, these mechanisms can be affected by dietary or environmental imbalances, metabolic defects, or genetics. Increased calcium oxalate supersaturation may result from low urine volume or excessive excretion of calcium or oxalate, or the combination of these factors. The process of anchoring crystals is poorly understood. Research has shown calcium oxalate stones develop on the surface of a renal papilla and the loop of Henle. Deposits of calcium phosphate in the interstitial sites form Randle plaques, which grow to erode the uroepithelium at the surface of the renal papilla and create a nucleus for calcium oxalate deposition. Normal crystals pass through the urinary tract without problems. However, if these crystals become large enough, they cause obstruction of the kidney drainage system and result in severe pain, bleeding, infection, or kidney failure. The common sites of obstruction in the upper urinary tract are located at the junction where the kidney meets the upper ureter, or the mid portion of the ureter, or the lower portion that enters the bladder. Most of the time, calcium kidney stones arise from the combination of inheritance, diet, and aspects of daily living. The risk of developing kidney stones is 1 in 10 in males and increases when presented with a family history of kidney stones, indigenous background, greater than 50 years old, and type 2 diabetes. Combined with these conditions, individuals who are stressed, inactive, and consume less water and have a processed, high-fat, high-animal product, high-dairy diet are more prone to kidney stone formation. Peter's clinical manifestations and history indicate he is at high risk of kidney stones. Signs of blood in Peter's urine and his difficulty urinating, combined with pain, suggest kidney stones. His acute pain originating in the lateral flanks Radiating to the abdomen is renal colic and indicates the obstruction is mid-ureter. This occurs due to the contraction of smooth muscles of the ureter attempting to move the stone. Dilation of the kidney and distension of renal capsule also occurs, which causes nausea and vomiting. However, further evaluation and diagnosis of kidney stones should be based on diagnostic tests and nursing interventions. Potential complications. Obstruction, increased pressure, and stasis of urine may cause stenosis or perforation of the ureter. Irritation of the epithelial lining with entrapment of bacteria can lead to infection of the kidneys. This is called pyelonephritis. The inflammation can go on to create local abscesses and scarring. Urosepsis is a progression of pyelonephritis after the infection has reached the bloodstream and circulated the body. Urosepsis can progress to septic shock, a serious and life-threatening condition, complicated by dropping of blood pressure, increased heart rate, and changes in mental status. If not treated, this will lead to death.
Pharmacological interventions. The first of medications is hydrochlorothiazide, which is a thiazide diuretic used to lower calcium excretion, prevent fluid retention, and to treat high blood pressure. It should not be used in patients who have a history of allergy or bronchial asthma to this kind of medication. Common adverse effects are nausea, vomiting, diarrhea, loss of appetite, and constipation. While Peter is taking this medication, he should not consume alcohol as this will induce side effects, and he should stay hydrated by drinking plenty of fluids. Diclofenac. This is a non-steroidal anti-inflammatory drug that will be used to treat Peter's pain. It should not be used in patients with known hypersensitivity to diclofenac, which may cause the allergic reactions of asthma, rashes, and other symptoms. It should also not be used in patients with GI bleeding, hepatic or kidney failure, and severe cardiac failure. Common adverse effects are similar to that of hydrochlorothiazide, but also includes dizziness, cloudy urine, and decrease in urine output. Safety considerations would be that it can lead to an onset of hypertension, so as a nurse we should monitor Peter's BP regularly and closely. Potassium citrate is used to treat kidney stones and should not be used in patients with kidney failure who have high potassium levels, uncontrollable diabetes, severe burns or other tissue injuries, and are severely dehydrated. Adverse effects are the common nausea, vomiting, and diarrhea, but it is also accompanied with stomach pains. As nurses, we should closely monitor Peter's potassium levels in case of hyperkalemia with regular blood tests and ECGs. In the case of a GI lesion, endoscopic exams should be done. Tamsulosin, or Flomax, is an alpha blocker and is prescribed to males in particular to relax their prostate and bladder neck, making it easier to urinate. This is being given to Peter as he is experiencing pain while urinating and has a decrease in urine volume. It should not be prescribed to those with a history of orthostatic hypotension and renal or hepatic impairment. The adverse effects are also nausea, diarrhea, and headache, plus dizziness, chest or back pain, or blurred vision. A severe reaction would be a penis erection lasting for as long as 4 hours. Tamsulosin may impair thinking and reaction time, so it is not recommended to drive. Peter should be advised of this, and he should also be advised to get up slowly and steadily to prevent a fall, and to also avoid standing for long periods of time. Prostate cancer should be checked for before and after treatment using tamsulosin, and regular blood pressure checks should be done.
Nursing management. The main nursing management priorities for Peter will include relieving the pain, maintaining sufficient renal functioning, prevention of further complications, and provide patient education on kidney stones and information about his prognosis and treatments that are available.
A nursing intervention that can be used for Peter is a renal ultrasound. A renal ultrasound is a non-invasive diagnostic procedure that produces images which identify the size, shape and location of Peter's kidney stone. The renal ultrasound is used to establish if there are any obstructive changes visible. Ultrasound can also be used as secondary usage for investigating the blood flow to the kidneys. Ureteral stones usually cannot be visualised using the ultrasound machines unless they are positioned at junction of both the bladder and ureter. This will be evident once completing the renal ultrasound.
A urinalysis. Urinalysis is performed to determine the chemical formation of the kidney stone when it is either filtered through the urine excretion or removed from the urinary tract. The urinary test is completed and evident in Peter's urine is red blood cells, white blood cells, and crystals, which are signs of infection, and it can also be used to determine the pH level of the urine. The evident colour of his urine can be visualised as a yellow, dark brown, bloody colour. When testing pH, levels that indicate less than 5 show evidence that it could be uric acid stones, and a pH level that is higher than 7.5 shows that it could be magnesium struvite phosphate or calcium phosphate stones.
A lithotripsy. Lithotripsy is one of the least invasive procedures for the removal of kidney stones. This could be suitable treatment for Peter. It uses high frequency waves from an outer source in order to break down the kidney stones, so a size that is small enough to pass through the urinary tract.
Pain management. Assessing Peter for pain and discomfort includes the location, type of pain, and radiation. A tool that can be used to assess what pain Peter is experiencing is the PQRST tool. The aim is to minimise the pain Peter is experiencing and reduce any symptoms such as nausea, vomiting, and abdominal distension. This can be achieved through the use of heat therapy and analgesic medication. Closely monitoring Peter will allow us to determine if the medication is being effective. Using a numerical pain scale using numbers 1 to 10, 1 being the least and 10 being the most, can assess if the pain has improved, is the same, or worse. Encouraging Peter to position himself into a comfortable position can help alleviate the pain.
Fluid intake. Determining Peter's normal voiding patterns can establish any changes in voiding. Peter may experience a more frequent need to void as the kidney stone can cause excitability of the nerves. Encouraging Peter to consume a sufficient amount of fluids can help flush out blood, bacteria and debris. Drinking approximately 3 to 4 litres of water per day corrects approximately 2.5 to 3 litres of urine. It is advised that Peter drinks approximately 250 ml before bed and if he wakes up in the middle of the night to prevent crystal formation.
Exercise. Creating an exercise plan for Peter can help dislodge the kidney stone as it will allow it to pass through the urinary tract, and it can also help in his weight loss.
Patient education. Explaining to Peter what a kidney stone is and how to prevent their formation. Encouraging Peter to follow the routine to avoid formation of the stones, such as maintaining a high fluid intake and exercise as much as possible. Educate the patient on the signs and symptoms of urinary tract infections, including fever, urinary retention, and chills. Inform him to notify when he has any pain or discomfort. National safety and quality service standards are important when caring for Peter Parker. Standard 3, preventing and controlling healthcare associated infections. Healthcare associated infections are the most common complication affecting patients in hospitals. Each year, around 200,000 healthcare associated infections are contracted by patients in Australia. Strategies can be put in place to prevent the risk of healthcare associated infections for Peter Parker. This can include such things as the non-touch technique, especially if the use of catheters is used and other equipment necessary.
Standard 4. Medication safety. Medications are the most common treatment used in healthcare. Because they are so commonly used, medicines are associated with a higher incidence of errors and adverse events than other healthcare interventions. Many of these events are costly and potentially avoidable. To ensure medication safety with Peter Parker, we will need to do the following. Medication history with all known allergies, a list of Peter's current medications, and create a medication management plan and educate with Peter about his medications he is taking.
Standard 5, patient identification and procedure matching. Ensuring the right care is provided to the right patient is an essential part of providing and receiving safe care. To confirm we have the correct patient, Peter Parker, it is essential that they have the right identifiers such as patient name, date of birth, gender, address, medical record number, or healthcare identifier.
Standard 9. Recognising and responding to clinical deterioration in an acute healthcare setting. Recognising that a patient's condition is deteriorating and responding to their needs in an appropriate and timely way is an essential component of safe and high quality care. To identify and respond to Peter Parker if deterioration is occurring, changes such as decreased urine output, fatigue, weight loss, headaches, fever, shortness of breath, edema, skin colour changes, change in urine colour, and any nausea or vomiting will be noticed. Any changes not recognised in our patient could lead to continued growth and can lead to urinary obstruction, chronic infection, destruction of the kidneys, and chronic kidney disease, which can progress to renal failure.
With correct knowledge, with pharmaceutical interventions,
with nursing interventions,
And using national health standards,
with all these components put together, Peter Parker's kidney stones have successfully been treated and he's been discharged from hospital.
thank you for listening to our presentation.